is Kristen, and I'm going to demonstrate how to insert an NG tube and irrigate an NG tube. So first I'm going to start by looking at the doctor's orders and see that he ordered a NG tube for suction, so we're going to use this type of NG tube. I'm going to start by hand hygiene. I'm going to assess the patient's nares for patency. Both nares are patent. I'm going to have him include one side and breathe in, and then include the other side and breathe in, and pick the most patent one. So we're going to go into the right nare. I'm going to measure the length of the tubing, starting at the nose to the ear, down to the xiphoid process, and mark it with a piece of tape. And then I'm going to have the patient tilt his head back. First I'm going to put on gloves. I'm going to have the patient tilt his head back, and then I'm going to insert the tube. I'm going to lubricate about 4 inches and warn him that I'm going to be inserting the tube now. So I'm going to start by going in slowly, making sure that there's no pressure. And then I'm going to check and make sure that it is not coiling in the back of the throat. And now I'm going to have him tilt his head down from his chin to his chest, and have him take small sips of water and insert every time he takes a sip. So I'm going to keep inserting until I get to the tape, and then I'm going to just temporarily tape it to his cheek. And now I'm going to verify the placement, so I'm going to have the patient talk and make sure that he's not choking or gagging. And then I'm going to listen for a whooshing sound when I put some air in. So I'm going to do 30 milliliters of air. Okay, so it's in the correct place. And now I'm going to take the temporary tape off. Okay, and then I'm going to safety pin it to his gown. Okay, and then I'm going to hook it up to the low intermittent suction. And I'm going to document the color, consistency, and amount of fluid coming out, and I'm going to document the time I inserted it, the length remaining from the nose to the suction, and how the patient tolerated it. So then I would remove my gloves, and now the doctor wants me to irrigate the NG tube, so I'm going to come back in, and I'm going to put on clean gloves. Okay, so I'm going to, first I'm going to disconnect it from the suction and place it on a towel. And I'm going to remove 30 milliliters and push back in 30 milliliters. And then I'm going to take 30 milliliters of water and push that in and pull that back out, and then discard. And then I'm going to rehook it back up to the suction. And I'm going to document the amount of water that I put in, so 30 milliliters of water, and I took 30 milliliters and discarded it.
and how the patient tolerated it.